The Meals on Wheels Association of America is a nonprofit national organization comprised of the Meals on Wheels community-based programs throughout the United States. MOA was founded in 1976 to make sure that these local community-based Meals on Wheels programs have the resources, the tools, and the information they need to feed a growing population of seniors. Our organization is the backbone for these local meal programs. There are approximately 5,000 senior nutrition programs, or Meals on Wheels programs, across the nation. Over 1 million meals a day are delivered nationally, mainly by volunteers who work in conditions that you cannot imagine, trudging through the snows of Alaska to the sweltering heat of South Texas. They visit people who have far outlived their savings and their relatives. Many only have the clothes that they're wearing and a long and interesting life history to share. And share they do. Our volunteers are a hardy army of men and women, and even some children. And they know that they might be the only visitors our recipients will ever see. Senior hunger is a serious problem, and we must actively increase our support to the local Meals on Wheels programs to address it. That means doing what we can to allow Meals on Wheels programs to purchase more food, maintain, repair, and buy more equipment, recruit more volunteers, whatever it takes, so they can serve more meals. Their waiting lists are growing. We cannot wait another day. We must help every Meals on Wheels program become self-sufficient and sustainable by providing the leadership training they need to succeed. So while we're helping local programs feed hungry seniors today, we're also making sure that they have the tools and information they need to feed the hungry seniors of tomorrow. We've come to realize that we can't solve senior hunger with the methods and systems we currently have. The face of senior hunger is changing. The problem is evolving, and the need is growing faster than we ever anticipated. In fact, in 2050, for the first time in our history, there will be more adults than children living in our world. And that is why MOA is working on a national level, continuing to research the issue, to create innovative programs and find new ways of reaching the hidden homebound. The Meals on Wheels Association of America was created to bring it all together. We were created as a mechanism for networking, education, fundraising, and to be a national voice for the cause of ending senior hunger. 5,000 local programs representing 1.7 million volunteers, thousands of employees, and millions of seniors need one central point that says, we are Meals on Wheels. And that is what MOA does. That is what MOA is. Unfortunately, our Meals on Wheels programs feeding 1 million meals a day to seniors is no longer good enough. Those numbers are enormous, more than most chain restaurants serving on any given day, 3 times more. But we're faced with a burgeoning crisis in America. We believe that there are probably at least 2 million more meals a day that are needed to be delivered to seniors to just barely meet that need. The need is great, and it's growing each day. In fact, many of our volunteers can no longer volunteer, but instead are seeking our services rather than providing them. Every 6 seconds, someone in America is turning 60. The good news is that our program is there for those who are 60 years of age and older. The bad news is that we can no longer keep up with the demand for services. We've had to create waiting lists for those seniors who are in desperate need of our meal services. Just how long can a person who is 85 years of age and hungry wait? We need to increase the resources to our Meals on Wheels programs, ensure that the community-based programs have the leadership they need to become successful and self-sufficient, and help find new ways to feed America's hungry and homebound. We talk about the value of educating our youngsters, but education must also extend beyond our youth. We need to continue to educate those who are employed in the human services professions about how to do more with less, how to become sustainable, and how to leverage good deeds with good governance and sound business practices. My objective as the president and CEO of the largest anti-hunger organization in the world is to ensure that we go out of business. I want to lead this organization to its demise. I've been with MOA for over 20 years now, and I am still astonished by the abject hunger and loneliness that is afflicting so many of our seniors today. I've traveled to every part of our country, from the streets of New York City to the farmlands of Kansas, to the Delta of Arkansas, to Appalachia and Hawaii. The towns change. The need doesn't. It just presents itself in many different forms. All who are hungry have the same characteristics. They're in need, and they can't wait. I truly believe that if we can locate the resources, correct our processes, and make wise decisions that are future-focused, we can end senior hunger by 2020. Currently, hunger is a growth industry in America, and yet we have enough food to feed every man, woman, and child. This is an unacceptable truth. We can do better. We must. In 2025, an estimated 9.5 million senior Americans will experience some form of food insecurity, about 75% higher than the number in 2005. Our objective is straightforward. We need to take stock of not just feeding seniors today. That's short-sighted. We need to figure out how to build a future system that uses resources that are already there and engage others in our cause. MOA is able to effect change because we are simultaneously working in 4 distinct areas, representing different and unique communities. First, we never forget the organizations that are providing the direct services, the local Meals on Wheels programs that are serving the meals and making the home visits. Our highest goal is to ensure that our member programs have what they need to succeed. In today's environment, that means making sure they have the financial resources to serve more meals, from purchasing additional equipment, to increasing public awareness, to recruiting more volunteers. What's really more exciting and more relevant for our programs is the second area where we have been successful, and that's in the leadership trainings we hold around the country. It's our belief that we must equip our Meals on Wheels leaders to manage a self-sufficient and successful organization, and we train them to do that effectively and efficiently. I've seen directors, managers, and volunteers participate in our trainings and walk away energized, enthusiastic, and armed with the best knowledge and techniques to take their program to the next level. And you know what? They have. Many of our programs have been more effective and efficient as a result of the leadership training program's impact on their leaders. We're also working on a national level with our nation's policymakers. Senior hunger is a huge issue, and one we must address both at the community level and at the national level. We are the voice of the voiceless seniors whom time seems to have forgotten or ignored. We stand with them, and we stand for them. We work tirelessly on Capitol Hill and in state capitals to ensure that those voices are heard. We advocate for the millions of seniors who may not vote, but deserve to participate in our democracy. Far too many legislators feel that they work on behalf of seniors when they discuss Social Security and Medicare. These are programs that we as Americans have paid into. But many seniors that we serve didn't pay into these programs. Our seniors are not looking for a government handout. They are instead looking for a helping hand. Theirs were the hands that built our roads and our highways and our schools, and they fed us when we were young. We owe them nothing less than to advocate for them. Finally, we are working with the American public to educate and inform them about the nation's senior hunger crisis. Unfortunately, senior hunger is a hidden problem, and for many Americans, it doesn't feel real or relevant. What most Americans don't realize is that they probably will know someone who is at risk of being hungry, feeding their pet before themselves, or skipping a meal to pay for medicine. It's just not seen, and it's not talked about. But we must look for it and talk about it. 1 in 9 seniors faces the threat of hunger in our country. We must face this issue, and MOA is here to make sure that people realize we're in a senior hunger crisis and that this dreaded situation has a solution. You are the solution. This is a crisis that we can end immediately. We just need to keep getting that message out there. We're effective on many levels. We're effective because we have so many Meals on Wheels volunteers. Over 1.7 million volunteers allow us to feed as many seniors as we do, and it will be the volunteers that take us to the next level. We're effective because we understand our demographic, and we work diligently to meet needs in urban communities, suburban communities, and rural communities. And we're effective because we've been at this for many, many years. Meals on Wheels programs have been around since the end of World War II. They've stood the test of time. They're a fixture in our vocabulary and in every community in America. The Meals on Wheels Association of America has been designated by the Better Business Bureau as a highly effective nonprofit, and we're proud of that distinction. We were also recently awarded a federal grant that designated us as the National Resource Center on Nutrition and Aging. In other words, even the feds think we're an effective organization. We consider this an honor. I'm most proud when I hear directly from the mouths of the very seniors our programs feed. According to the National Survey of Older Americans Act programs, conducted for the United States Administration on Aging, our recipients have told us that Meals on Wheels helps them eat healthier, feel more secure, and that the service is excellent. In fact, an overwhelming 93% say Meals on Wheels means that they can continue to live in their own homes. And that's the real difference we make. And we're working very hard so no senior goes hungry. The success metrics in the nonprofit world are quite different from those of our friends in corporate America. It sounds simple enough, but it isn't. Purely quantitatively speaking, the number of meals our local Meals on Wheels programs and volunteers serve or deliver each day across the country is approximately 1 million. Our statistics show that what we do with relatively tight budgets is pretty terrific. And preliminary research findings suggest that our nutritious meals make quite a difference to seniors who have been recently discharged from the hospital. Their readmission rates to hospitals and institutions significantly decrease because of good health outcomes as a result of proper nutrition. But for the work that we do, those numbers miss a big part of the picture. How does one quantify the potentially far-reaching emotional, physical, and social effects of a volunteer's interaction with a senior who sees no one else during the week? How do we truly encompass and then calculate the direct and indirect effects of our multi-pronged approach to ending senior hunger? While we're seeking to embark on research that would build the case for our work and evaluate some of our local interventions, the one true metric of our success is whether we end senior hunger in America. And this is quantified by the number of seniors that are still going hungry. According to our estimates, there are over 6 million seniors, individuals 60 years of age and older in the United States, who are food insecure. We've come a long way in terms of bringing attention to an often hidden issue, influencing policymakers and providing direct support and services to hungry seniors. We can give you numbers on media hits, impressions, and the names of national and local policymakers who support our cause. We can show you how much money we've distributed to our local programs. But as long as there are seniors going hungry, we are failing. I'm failing as a national leader because I hold myself to a higher standard. Our success is defined by the fulfillment of our mission. We are working toward a goal, and we celebrate our smaller achievements. But true success will be realized for our organization when no senior goes hungry. I think the most common misperception of Meals on Wheels is that it's a federally funded program. In fact, there are many people who actually think that it is an entitlement program for seniors. Nothing could be further from the truth. While many programs receive federal funding under the Older Americans Act, that funding accounts for less than 30%. 70% of the funding, then, must be raised from other sources. Those other sources include private donations, bake sales, car washes, spaghetti suppers, and the like. These are truly grassroots programs that operate within local communities and serve local clients. Hunger is usually not thought of as an American problem. If it were, most would envision children going hungry. Children have access to WIC and Head Start feeding programs, and school lunch and after-school feeding programs, food stamps, even food banks. A senior who is homebound has access to none of these programs. Now, I would never for 1 minute pit one segment of society against another in terms of human services. But the issue here is misrepresentation and a lack of common knowledge. The Meals on Wheels Association of America must make the case that the only real program to help meet the hunger and nutrition needs of seniors is Meals on Wheels. We work on a daily basis to get the message out that our programs are truly grassroots, that they are a combination of public and private funds, and sometimes totally privately funded community-based programs. It doesn't seem to be common knowledge, and we're trying to correct that misperception. We're proud of many of the things that the Meals on Wheels Association of America has accomplished. We received the Better Business Bureau's designation as an accredited charity, a designation that is earned rather than given. We have enlisted elected officials at every level of government for our cause. For example, every March we hold a campaign that we call Mayors for Meals. We recruit local mayors and other elected officials to deliver meals. We have had over 1,200 mayors delivering meals to homebound seniors. To have elected officials deliver Meals on Wheels in their communities reaps many rewards and sends a message out about our need for resources and volunteers. Another of our major accomplishments was a groundbreaking research study that we had underwritten called The Causes, Consequences, and Future of Senior Hunger. Dr. James Ziliak of the University of Kentucky's Center on Poverty and Dr. Craig Gunderson from Iowa State University did this research. The issue of senior hunger had never before been explored in quite this way. The results helped us to better understand the scope of senior hunger and where it exists. The study revealed the top 10 senior hunger states in our country, which are mostly in the South. The findings of this work have become the benchmark for understanding and defining the issue. Unfortunately, we've not been able to update the research, and we suspect the numbers have probably increased dramatically. We know anecdotally that the rise in senior hunger is alarming. More research is desperately needed to confirm this. There are two issues to address. First is a historical challenge, and the second is a vulnerability that we face. The historical challenge is that our Meals on Wheels programs vary in size, geography, demographics, funding streams, etc. This is a challenge for us because some programs don't perform as well as others. Typically, smaller programs with smaller budgets and staff support that are independent and standalone nonprofits have a harder time raising the funding they need to receive the necessary training and education to do their work more effectively. It's the vicious cycle of not having the money you need to spend the money you need to do a better job. All of our programs must be given the tools to become more sustainable and much more future-focused. We need to teach many of our programs how to fish, so to speak, and then put them on that boat and challenge them to become even better community-based, locally run human services agencies in all communities. Small-town America's seniors need and deserve the same services as those seniors who happen to live in larger cities. Food deserts plague our rural areas and even some not-so-rural areas. Our historical challenge of viewing this phenomenon as our fate is unacceptable. The vulnerability is the threat of outside forces, particularly those in the for-profit arena, which see our services as a vehicle for profit. It is indeed true that a meal could be drop-shipped and left on the doorstep of a vulnerable senior. The problem with that is that the senior may have a difficult time getting to the door to pick up the meal and then put it in the microwave and heat it up. This dynamic is fraught with many problems, not the least of which is a growing epidemic of foodborne illness. Community-based senior nutrition programs deliver more than a meal. They are a watchful pair of eyes and ears, looking after the well-being of our nation's elderly. Additional resources are desperately needed, not only for grants for our Meals on Wheels programs to purchase more food and upgrade their equipment, but more important are the resources needed to educate our programs and provide the training they need to be able to work more effectively and efficiently. We need to be able to develop more training tools and modules that allow us to screen and assess those who are receiving our services to make sure that they should remain on the program. We also need the metrics to make sure that our programs are future-ready, so that the services offered today are the right ones for the seniors of tomorrow. We need to engage researchers and social scientists to work alongside us as we evaluate where this program fits in a new normal society. And finally, we need to work at reevaluating our programs to ensure that they are, in fact, sustainable. We need additional resources to shore up the gaps within our organization and the local Meals on Wheels programs we represent. We need to evaluate our programs to determine what works and collect information about those results. We need to analyze the results systematically and then redo, reevaluate, and adjust to be responsive to the new information we glean from the research. In order to be sustainable, nonprofit, community-based organizations, we must have an absolute focus on producing results for those who we serve. We are entrusted to serve those people. Putting the best academic research and evidence-based outcome research into practice will enable us to provide the best and most cost-effective nutrition services to our vulnerable seniors.